And we'll be ready to go once Dr. Rademacher jumps on.
Hey,
There we
Dr.
go.
Rademacher, how are you?
Good afternoon, everybody. I'm Myra Ansari here for Wave Now. It is a little after 12:30 here on your Wednesday afternoon. I had to stop and think, what day is it? So we are going live to Norton Healthcare today because they're talking about the flu. As some of you may know, hopefully you don't have the flu, but it is going around. If you've ever had the flu, you know it can be pretty downright miserable. So doctors and medical experts, they're encouraging folks to get the flu vaccine now if you haven't already. And again, just as a reminder, just from the stories that I've covered over the years, you know, the flu shot doesn't stop you from getting the flu. Some may think that, but it just, if you do happen to get the flu, it hopefully will lessen your symptoms. So I got mine over the weekend. It was quick and painless. Again, that's, you know, medical experts say that it's just something you should get. Especially with flu cases that are going around. I know it's going around in my kiddo's school right now as well. So we are going to jump into this press conference. Norton Healthcare is going to be talking to us about the increase in flu cases that we're seeing with adults and also in children in the area.
Yesterday, but tomorrow and today always that's the second and third best. So we have Dr. Heather Felton and Dr. Mary Rademacher on now. First, we're going to start with Dr. Rademacher, just to kind of give an overview of what we're seeing at Norton Healthcare providers, adults and pediatrics.
Sure, I'd be glad to. Thank you. One thing that we've noticed is in the last few weeks, we've seen just a very rapid escalation of flu cases as this flu season seems to be settling in, as you said, on the heels of RSV and then the ongoing COVID cases that we have. Just to give you an idea of some real numbers, we have had so far over 2,200 cases of patients with flu just last week. And that was about 50% more than the week prior, which was right at about 1,500. And then the week before that, you could just see the rapid escalation. There were only about 535 cases the week prior. As of this week, as of yesterday, we have already had just under 750 cases this week so far.
And Dr. Felton, obviously the big part of this is pediatrics. So what are we seeing from the children's side?
We're seeing something very similar to what the adults are experiencing as well. There's been a really rapid increase in influenza cases throughout children all over the country, but we're seeing it here within the Norton Healthcare system as well. So even just a month ago, we only had about 70 cases of flu. That increased to over 300 the following week, over 1,000 the week after that, and 1,600 cases just last week. And we've already had over 500 cases this week. So I've felt it a lot in my practice. It really seems to have spiked very quickly in the last couple of weeks.
And how, I know a lot of people have asked about hospitalizations and that sort of thing, but we're not necessarily seeing the same, this isn't corresponding to a pretty big an escalation in patients that we're seeing at the hospital, correct?
Not necessarily hospitalizations always, not with influenza at least, but that means we're still seeing a lot of our patients in like their outpatient, like a pediatrician's office and immediate care, and in the ER as well, that have all been really busy.
All right. And Dr. Rademacher, what are some signs and symptoms that parents and families can look for, not just in their children, but in themselves if they think they might have the flu?
Sure. The flu is a pretty consistent illness year over year with fever, chills, body aches, headache, typically a cough. Sometimes people will have gastrointestinal issues depending on the strain of the flu. They might have a sore throat. This is where there's certainly overlap with COVID. But the flu remains pretty consistent while COVID can really have some wide variation in its symptoms.
And Dr. Felton, is there any difference between the symptoms that we see in adults and the symptoms that we see in children who are suspected of having the flu?
No, the symptoms are pretty similar for influenza for adults and for children. We usually see high fevers is pretty consistent, but also body aches and chills. I would say that right now, in particular, we're seeing a little bit more GI illness, but every strain can be a little bit different. But overall, it's a pretty consistent disease between adults and kids.
And Dr. Rademacher, why is it so important for people to get their flu vaccines now, since we're seeing this escalation?
Well, as you alluded to earlier, it would have been ideal if they had already gotten it since we're seeing such a rapid increase in cases. It takes about 2 weeks for your body to develop immunity after getting the vaccine. So just the sooner that people can get it, the better, so that they can build antibodies and be protected. Because the flu obviously has consequences around hospitalization and, secondary infections, other illness. So as soon as possible, get a flu shot.
And is there a difference between vaccinations for vaccines that are available for people who are older?
Yes. For persons who are 65 years and older, there's a high dose flu vaccine. And the reason for that is younger people in general will mount a more robust response, a more robust immunity to the vaccine. And so people who are older who have less robust immune systems are given a high dose so that they can mount the same kind of immunity as a younger person when they receive the flu vaccine.
All right. I'm going to go ahead and open it up to anybody who has any questions for either of the doctors.
Dr. Rademacher, this is Paul Miles. How are you?
Good.
The numbers you cited, is that system-wide in Norton?
System-wide, yes.
And for yourself or Dr. Felton, this increase in cases, how much of that is due to the fact that perhaps many people in the past have masked up, they've social distanced, and we're starting to get away from that? And how much of it has to do with maybe a lack of immunity?
I think that there are different flu strains every year, and some tend to cause more severe disease than others. We kind of predicted that this strain this year was going to be kind of a worse strain, and we anticipated a worse flu season. I was hearing that even as early as this past summer, that could be the case. I do think that masking right now, especially when indoors, can be a good idea to help prevent the spread, especially as we go into the holiday season and people are gathering closer together, and staying home when you're sick. I think those are still things to keep in mind and to consider as precautionary measures in addition to getting your flu vaccine.
I would agree. And I think a testimony to that is when there was so much masking at some peak times in COVID in the quote unquote flu season of 2021, we didn't have any influenza. So it tells you what a difference it can make.
All right.
What is your prediction for the holidays? Are you expecting a surge in these cases, both in adults and children?
It feels like we're in one right now. So it's hard. It's a little hard to say, but with the number we're seeing increasing, I don't know what you think, Heather. I think as people get in larger groups and closer together, it's bound to increase.
That would be my concern as well, especially going into a period where people are traveling more and getting together in groups and gathering indoors. So I think that it is important to be mindful of how many cases there are right now. And if you're sick or a family member is sick, it might be best to stay home and to skip it this year to prevent the spread of illness.
Are either one of you seeing the cases where people have both flu and COVID?
We've had a few, yes.
We've had a few as well. I'm seeing all kinds of viruses right now. We don't do usually a viral panel in our office, but that will happen if a patient's been to the ER or to the hospital. And I do see lots of children who have multiple viruses, not necessarily always COVID, flu, or RSV, but there are thousands of possibilities and they'll come back sometimes positive for 2 or 3 at the same time.
And kind of going back to our original conversation, what do you attribute this spike, this surge in flu cases to? Either one of you.
I think this is the natural evolution of flu season historically. And I think that we're seeing more cases again, simply because of the relaxed constraints around social gathering and masking, et cetera.
I would agree as well.
Thank you.
All right, we have one question in the chat from Brooke Hash with the HAS 11. Is flu still more rampant locally than COVID and RSV?
I'm definitely seeing more influenza. It feels like this week and last week, maybe. We still have patients who have RSV, but it does appear to be slowing down a little bit. Certainly over the last month, it seemed like RSV was the predominant illness that we were seeing that was taking kids to the pediatrician's office or to the ER. And that seems to have slowed a little bit and flu is taking its place.
I would say the same in the immediate care centers. Definitely more flu than COVID. There's always an undercurrent of COVID. The testing that we do tests for COVID and flu, so we can objectively see, which is greater, and flu is certainly greater. Influenza A specifically right now.
This is Paul again. Are you guys seeing any sort of immunization fatigue left over from COVID affecting flu vaccinations?
I find that there's the most hesitancy probably still around the COVID vaccine. I think that families who were likely to get their flu vaccine before are still likely to do so.
I would say the same, and quite a few people we see have received the new bivalent COVID at the same time that they received their flu vaccine this season.
It's Myra from Wave. Can I ask a question? Can you all hear me?
Mm-hmm. Yeah.
Yes.
We have a question from a viewer by the name of Carol Hess, and she wants to know if a person is allergic to the flu vaccine, are there any alternatives? Thank you.
Dr. Rademacher, you want to take that one?
I can't. It depends on the nature of problem that they have, that's a hard question to answer specifically. It depends on what is the nature of the allergy. They may want to check with their pharmacist and just look at the nature of the reaction that they had.
I would agree with that as well. Sometimes I will have patients also check in with their allergist, especially if it's something like a true anaphylactic reaction that they've had before and they want to be cautious. Sometimes we'll have them check with their allergist, but people do have concern when they have an egg allergy, but you can get a flu vaccine now, even if you do have an allergy to egg, but it's recommended to do it in a doctor's office. So if you have questions or concerns or looking for an alternative, I would say start with your primary care physician and then maybe a specialist too if you get other questions.
And Myra also has a question in the chat. Is there any advice for people who want to gather together indoors for the holidays?
I think definitely if a person isn't feeling well, even if they think they just have a cold, they should absent themselves from the gathering. We see so many people who really do have COVID or the flu who have relatively mild symptoms, particularly COVID. And also, if a person has a compromised immune system or some significant chronic health problems, they would likely want to wear a mask when they're gathered with their family or friends.
I would agree with that as well. I think it's really important to be mindful of illness ahead of time and not partake in a gathering if you are, in my case, it's a child oftentimes, and so it usually requires that the family not attend. But I think getting your vaccines are really important. Getting a flu shot and getting a COVID vaccine. The COVID vaccine is approved for children as young as 6 months old. And children as young as 5 can get the updated bivalent booster, which I also recommend. And I think that those are important preventative measures that you can take so that you don't have a last minute illness that would cause you to miss a holiday.
All right. Does anybody else have any other questions? All right. Well, we want to thank you all for coming, and Dr. Rademacher and Dr. Felton for sharing your expertise on this important subject.
Thanks for having us.
Yes, thank you.
And Lynn will be sending out the recording of this to everyone who is here today. So we appreciate your time.
Thank you, Kevin.